For the hip internal and external rotation tests, we have some minimum standards that we want to try and aim for various common movements within the gym. External rotation, which is this way, it seems like it should be internal rotation because your foot is coming inwards, but it's in relation to what your thigh is doing. Your thigh bone is externally rotating in its hip socket in this direction, and this is important for squats, deadlifts, lunges, etc. Are things where we're trying to sit our hips straight downwards or we're trying to hinge at the hip. Our external rotation is quite important to be able to do that. Internal rotation of the hip is when the thigh bone here is internally rotating within its hip socket or my ankle is coming outwards. And this is quite important for hip hinge based exercises like Romanian deadlifts or for some variations of lunges as well. And this is a relatively simple metric to use to understand what might be causing your hips to feel tight. It's a very common thing. People will say something like, I feel really tight in my hips when I come to do a squat, and their external rotation will only let them go to there. That is a really common scenario for people to find themselves in. So minimum standards we want to see with external rotation is that this can get to about 45 degrees on both legs, obviously. So you're going to score each leg independently. So from this perspective, this is just about 45 degrees. So because it's only just and it takes a little bit of effort for me to get there, I'm going to give myself a 90% score. My left side is a little bit tighter than my right side as well. So if we do the comparison, you should see that my right side goes way further. My right side, I'm going to give myself 100% because I never have problems with my right hip. I never have problems with my right side of my lower back, and it's only ever in my left-hand side, and it's because my external rotation is a little bit more tight, and it takes a lot more effort for me to try and fix that. So external rotation on my right leg, this would be 100% for me, and then my left leg is a little bit tight, so I'm going to give myself 90 to 80%. The internal rotation, all we're looking for is that you can get the ankle to be seen outside of the knee joint when you're looking at it from the top down here. So as long as you have some internal rotation, that tends to be enough for most people. We don't need the internal rotation to be out at the 45 degrees unless you have very specific sporting demands, in which case you need a proper assessment anyway. So if that is the case, then you need to get in touch. But from a generic perspective like this, internal rotation, as long as you have some, you're fine. So from here, I'm giving myself 100% because I have some, and on my right hand side, I have some, so I'm giving myself 100%. A final little point, my hands here are on my pelvis as well, because what we can commonly do is as you try to push into this rotation, you may feel your left hip bone try to drop down towards the wall over here, and this right hip try and come up. What your brain is trying to do is fake rotation of the leg in the socket and cause the pelvis to tilt from side to side to give you more range of motion. And the same thing with the internal rotation. When you go out in this direction, if you feel your left hand hip bone come upwards and your right hand hip bone go downwards, then again you're getting fake rotation from the pelvis, not from the hip joint itself. So it's quite important to be true to yourself here and make sure that you can feel if something like that is happening. So if you have some internal rotation, 45 degrees external rotation, and no hip movement, then you can give yourself a pretty high score from that perspective.